If you've not watched the previous video on Payment Options 4.0, do that. Watch that one first before you watch this, because that has more detail about how you can most effectively use the payment options in your office. And this video is just going to show you the changes that we've made in the latest version. Let me show you some new features in Payment Options 5.0. This is our current release. And basically it works the same way, but with a couple minor changes to try and make it a little bit more user-friendly. First of all, I didn't say in the other video, but it's not, you don't have to put anything in this green box up at the top, but you can put something in there if you want. And what I suggest is that you name your different treatment plans. Okay, here's our named treatment plan right up at the top, and you have to put that in there in Open Dental so you can keep track of things. I can copy this and paste it right there. Now you got a description of the treatment that's going to show up on your payment options when you print it out. Okay, so let's quickly put some numbers in there. There's our total treatment. It's going to be $54.11. Our primary insurance is going to be $1,000. This is working exactly the same way as we did before. Our secondary is $25.89.40, and the in-house discount plan in this case is 0. We went over that before. You can change the percentage. All that stuff is the same as it was in the previous version. Down here is where it's a little bit different. Now it works the same way, that you can say, okay, I'm going to have 5 in-house payments, 12 months, whatever. Okay. What's different is that if you put numbers in the pink section, they're sticky. In other words, next time you open the payment options, those same numbers will be there. So if you have defaults for the office, for example, 12 months for interest-free payment, that you just leave that 12 months in there. You don't have to. You can change it each time, but it's sticky. Next time you open it, it'll be whatever it was set up to the time before. Now, the other thing that's new is that when you change these to 0, for instance, if I change that to 0, it's going to disappear out of the payment options. So let me put that back in. Let's go in and look at the printout here. There's our senior discount. Okay, there's the insurance and so forth. There's the prepayment. So all the numbers that were over here work the same way. So I'm going to close this again, and I'm going to go in here and take out the senior discount. Make that 0. This patient's not a senior. Let's look at the thing again. That senior disappeared. Okay, so you're not putting a senior citizen discount in there as 0. Okay, we don't want to do that. That kind of looks bad. Okay, and as a matter of fact, all these things will disappear. So let's take out this one. I'm going to close this. Well, keep in mind here, we had 5 in-office payments. We had 12 months. And down here, we had the extended payment plan. So let's close this. Let's go back here. Let's change this to 0. Let's change this to 0. Let's change this one down here to 0. Okay, and then there's one more button. Well, let's just see what this looks like before I click that button. Everything disappeared except this extended payment plan. Now, I don't recommend you use it this way, but you can. And if you want to write your own payment plan in there, remember we printed it out on paper. If you want to write something else in there, that's fine. Don't forget to make your notes on here, patient initials that you sign it, you scan it, and then you give this to the patient. Okay, so you can do this any way you want. But say, wait a minute, I don't want to do the extended payment plan either. Okay, you don't have to. You just go back here and click this little box which says Hide Extended Payment Plan. That disappeared out of there. Okay, but you still got the insurance information in there. All this stuff still works. This stuff is not sticky. You notice it printed the description of the treatment up here, and you can also put the patient's name there too if you want to. So those are the new improved features in Payment Options 5.0. These things are sticky. When you close this, close that. So next time I open Payment Options again, it's sticky. It remembered where we had those things. So if we set this at 12 months, and we won't even do a preview, we'll just close it and go open it again, and there it is at 12 months again. Okay, so these are sticky. These things up here are not sticky. So that's Payment Options 5.0.